Good afternoon, good morning. Welcome to our March Willis Long and Friends conversation. My co-host and dear friend Dana Long is with me, and we'd like to offer these conversations to you in order to advance our Nurture Connection initiative, all of which seeks to advance early relational health to support strong, positive, and nurturing relationships and to build healthier, resilient, and more connected communities. Dana?
Hello, it's so wonderful to be here virtually with everyone. We're really excited about this session of Willis Long and Friends. Just as a reminder, Willis Long and Friends, it's a lively live stream series that's hosted by Dr. David Willis and I. And our goal is to explore intentional and thought-provoking conversations around advancing early relational health in children's, families, and communities. And we offer this opportunity as a way to have fun and meaningful dialogue that will influence our action. And it will also propel us along the journey for nature connection. And nature connection is the way that we are creating the movement for early relational health. And that movement includes all of you. Our experts that join us in these conversations are from across the nation. We try to go to every corner. They share their personal narratives. They share their pilots programs, their policy work, groundbreaking research, and they inspire us all to be better. And we can learn from every single speaker.
Yeah, Dana, that's why I love these sessions so much, right? We get to introduce to you and share our friends, our colleagues, our thought leaders, all of whom are inspiring us along this journey of growing this Nurture Connection movement. Today is really special for me because I get to bring our Oregon friends from the Oregon Association of Relief Nurseries, and we're going to talk about how their work brings ERH in action to the community level. And I'm very excited about the relief nurseries because I learned about relief nurseries many years ago when I was a clinician in Oregon working about early relational health work in early childhood systems work. I discovered the sort of one of the flagships in Eugene, but also in Salem for the family buildings blocks, actually, which just was down the street from my sister-in-law at Chelsea Center, which was a relief nursery there. And I had the chance to actually do a site visit and meet the director and meet some of the providers and families. And I was so deeply inspired by the work. Then I went off to HRSA and lost track a bit, but then came back around and was able to attend. I met Amber Ziring, and I did some work with the Oregon Pediatric Society that I'll talk about in a moment, and then had the chance to meet Cara and then get reconnected to this amazing work that the Oregon Relief Nurseries bring in support of relational health, in support of families. So let me share with you our two guests today. One is Cara Copeland, who is the executive director of the Oregon Association of Relief Nurseries. She, before that, was a director of a local relief nursery in McMinnville. Actually, that's where I started my clinical practice, McMinnville in pediatrics. And she's did her graduate studies in the impact of relationships between parent and children for later outcomes. Boy, is that dear to our heart, Cara. That's the center of how we're thinking about relational health, partnering with families to improve their well-being and their experiences. And then my dear friend Amber Ziring, she and I met through the work with the Oregon Pediatric Society and the ASHU project, which was promoting social emotional being and partnering with families. And she's now come to be the program director at the Oregon Association of Relief Nurseries. And she's a social worker by training. And what's striking to me, Amber, is your work as a birth assistant in rural Honduras, your work in the Syrian refugee camps, bless you, and the work about the guidance of infant feeding in emergencies. I know how you did that work within Oregon, and you're passionate about public health prevention and believe in the power of community. So what an amazing opportunity to be together today. And Dana, how about if I lean to you to kind of get us kicked off and started?
Wonderful. There's so much that we want to know. I'm wondering if, in order to set the tone for this conversation, if you actually could define what a relief nursery is, and then we can move on from there. And so, Amber, can you start with what is a relief nursery?
Certainly. Relief nurseries are work to strengthen protective factors within families. And we use those identified by the CSSP, and they're strategies that build positive outcomes in families. We reduce stress, and that reduction in stress can lead to the healthy family environments and healthy early childhood outcomes. So we provide this through outreach services where we're meeting with families in their home and we're helping them with basic needs support. We're helping them understand their own parenting questions. We're helping to answer those and engaging with them as they develop their own goals for what they need to move their family into the vision that they have for themselves. And often we're in crisis response. We get a phone call asking, will you help me? And we can be out there often within the same day and certainly within the same week to help new families as they engage in our services. We also offer really intensive case management to help our families get the referrals that they need, to connect them, to help reduce any barriers to engaging in the services within the community. And we also want to support constructive problem solving with our families, that we're not doing it for, we're doing it with them. And we also provide respite care. There's planned respite care days, and occasionally we have emergent respite care that needs to happen, and we're providing that to our families on an as-needed basis. And because oftentimes our families don't have somebody who's safe in their life to watch their children while they deal with an urgent need. So when I say basic needs, we're providing food and hygiene items, diapers, clothing, and transportation, really those solid things that you need for any healthy family. We offer evidence-based parenting classes and to increase the parents' understanding of positive parenting practices and to understand their own child's development. And also working to create social connections, that we're trying to build those connections, that parent-to-parent network, finding the community members that are sources of support for our families and with our families. And we also provide and promote children's social and emotional development. And what is unique is our approach for this, because we provide it through therapeutically developmentally appropriate classrooms. So we have low numbers of children. We have no more than 11 children, and we have 3 adults in that classroom to work with children on their social emotional development, to help them prepare for their next step in their journey, to prepare to be learners, to prepare to deal with life stressors. We're really engaging in building that emotional intelligence with the parents as well with the children. So our teachers are also the home visitors. So having that trusting teacher-child relationship helps us build trusting and meaningful relationships with their parents, so that we can work on behaviors that make their appearance both at home and at school, and that we can work as the same team together. And we want to promote those trusting relationships because that's something that many of our families struggle with in the day-to-day. And so can we model that? Can we model what it looks like to build trust, to repair if trust has been broken, and to learn that we don't have to rely only on ourselves, that we have a community that we can do that. So many of our families have the requirement for our eligibility is 5 stressors that can impact or increase the probability of child abuse or neglect. Most of our families have about 15. So the relief nurseries work with families that have the highest need for connection, that have the highest need for safe relationships to develop themselves.
Thank you for that explanation. There's so much more that I want to know. It's just a sub question, Cara, and then we'll move on to a question for you. But how do families get to you? How do they find the relief nurseries?
There is no wrong door to getting to a relief nursery, and it can vary from community to community where primary connections are built. Families can self-refer. They can just call us and ask for help. and we will engage with them. Oftentimes, we're serving families in an immediate crisis, and they feel so supported that they engage in that longer term connection and program involvement. We receive referrals from pediatricians. We receive referrals from coalitions within the community, other programs like Head Start. Oftentimes, children that aren't quite ready for the group size of 18 children in a Head Start classroom come to us because we can build with them that socio-emotional development to help them be prepared for other settings. We have such a variety. Sometimes grandparents are calling in, asking for support, looking for support because they're not there in the community to support their families. Other early intervention we work with. There's no wrong door. If somebody calls, we take that referral.
Amazing. Cara, can you talk a little bit about your own journey to get to the relief nurseries and what inspires you to do the work?
Yeah, no, thanks, Dana. I'm just so happy to be here, and this is what I love talking about, and it's the work that I love doing. Some people have a really linear career path. Mine has not been. I stumbled into early childhood work and this kind of family support and parenting support work. Earlier in my career, I was working with a organization that worked with youth who were leaving the commercial sexual exploitation industry. So I was mentoring youth in Portland. I remember one girl, she's about 15 years old, and she had been sold repeatedly to adults in the community since she was age 12. I had a chance to meet her family, and I really entered her story. And that's when I knew, gosh, there's got to be something that we can do upstream, right? That there's this kind of existence, this where some of our most vulnerable youth find themselves. There has to have been a turning point where she ended up in this industry. And it was at about that point that I found out about relief nurseries and found out that my own community was trying to develop a relief nursery. And so I became a parenting educator, which means that I went into a community home where women who were involved in our judicial system, they've been using substances, and instead of removing children, our community had these collective homes where they lived in. So I went into the home. I worked with those young mothers. They were pregnanting, they were parenting infants and toddlers, and we worked on parenting strategies. But I think actually what we were doing was building a community of support. Last month, this group on this podcast talked to Bruce Perry, and I just encourage folks, if you haven't heard that, go back to February, listen to Bruce Perry talk about these, what he calls relational bubbles of connectivity. That's what relief nurseries are doing, and that's what I fell in love with. I also just happen to love infants and toddlers. I mean, I could just spend my day with infants and toddlers and watching their parents be in love with them and be exasperated with them and watch them grow and develop. So having, my background was not early childhood. It was education and higher education. I was teaching sociology at a university. And I just love being in the middle of the work, seeing the work happen. And then now I get to be a part of advocating for the work, researching, continuing to do research, and developing these kinds of opportunities, relief nursery opportunities for more and more parents in Oregon. So yeah, that's a little bit of how I fell into it and why I am just in love with it.
It's phenomenal. Amber, how about you? How did you get here in your journey? You referenced a number of things, but what calls you now into this work?
Oh, my work with parents all over the world in Honduras, El Salvador, Mexico, with the Syrian refugees, with families across the socioeconomic scale in the US, what just brings me such joy and a wonder and amazement is their concerns are so universal. I want my child to have better than I have. I want my child to do well and to thrive. And am I enough? That question just, it's been translated to me and from me so many times from parents. Am I enough? And just that passion for helping people believe, helping families believe, helping children, helping adolescents believe they are enough. That is such a driving passion for me. So I'm a lactation consultant in addition to all my other hats, and I approach it from a relational standpoint. I approach it from social work. How do we have a mental health approach to feeding your child? And that comes both whether your breastfeeding relationship, if that's how you choose to feed, or later on, what traumas are you bringing from your own childhood into the feeding relationship? What do your resources say about how you choose to feed your children in your relationships during that time? And in early childhood and infancy, toddler, so much of our time is spent on keeping our children alive with nourishment. And it can be so foundational for those relationships as we build them. And I always look at that through that mental health relationship built lens. And how can we promote early relational health through that, childhood family well-being through that, so that the story is a positive story instead of one that was fraught with challenges. I was in child welfare for many years, and Dana, I'll loop back. We receive referrals from child welfare for families that they find to be at risk, but there hasn't been an incident happening. And I just saw how traumatic that system is. And even though I had as close to a good job as one can have in that, I was working kinship and adoption. So I was trying to keep children within their family systems, even if they couldn't be with their parents. And it was still such a trauma-fraught approach. And that just created my passion for attachment parenting and for looking upstream and knowing what can we do before the crisis to keep the crisis from ever arriving. And that's what led me here. And that's what relief nurseries are, is we are preventing that ultimate crisis whenever possible.
You know, we're learning that the ERH movement is also trying to narrow the door of child welfare. And your good work, which is a relationally centric approach in valuing the capacities of families, back to Amber, you know, every family wants best they can have for their babies, and asking the question, am I enough? And the real answer is no, because you've got to have other connections. Mm-hmm. And thereby your relief nurseries in communities have really moved that kind of sense. And I'm really curious if you might describe OARN and also describe a bit of its history, but also describe the community. How do you get these networks built in communities? I wonder, Cara, do you want to talk about that, or Amber?
Yeah, I mean, I guess I can take that and let Amber talk a little bit more about the details of what we do. So just to, you know, when I think if folks are listening and they're from a state that doesn't have relief nurseries, I think the story of the growth and development of relief nurseries is important in Oregon. We think it's pretty special. It originated back in 1976 in Eugene, Oregon. A group of community leaders seeing that the families in their community did not have the support. Young parents were struggling. They were going to court, and there was nowhere for the children to be while they fought for their rights, and they fought for different things that are impacting parents. And so they started a respite program in the basement of a church, just volunteers doing this. I think that that's key also to developing a network in any state, but particularly in Oregon, of communities that care about children and families, is that it's everyone's responsibility, right? It's not the state's responsibility. Doesn't lie on the backs of philanthropy, but everyone has a piece to play. And so 1976, relief nurseries begin, and then the word gets out that that particular community created what now is a trademarked model called Relief Nursery, out of Eugene and Springfield, Relief Nursery Incorporated. And their model they have gifted to Oregon. And they've gifted that through the Oregon Association of Relief Nurseries. It's a model that has, I'm going to say, 150 quality assurance standards that Amber and her team monitor and track and train staff in. But they're developed from communities that say, hey, our families matter. Communities raise private support often to start relief nurseries, and local foundations. We've got several local foundations in Oregon who are committed to the starting of and maintaining of relief nurseries. And so I think a state looking at developing a system of these kind of community-centered programs, it's a public-private partnership. Our website can go into the logistics of, communities reaching out to now what is called the Oregon Association of Relief Nurseries. We're just the body, the support group that helps make sure every relief nursery has what they need to exist. We're a small team of 5 people, but we do the work of training. We do the work of teaching new communities how to become a relief nursery. And then we do advocacy work, developing policy, advocating for the state funding, and really looking out for the network. We now have 38 sites across Oregon. We're serving about 2,300 families. And so that's a little bit, since 1976 to, 2023, we're currently building 3 new relief nurseries right now. We're training them and developing them right now, and working with our legislature to ensure that the funding is available for the public side of the public-private partnership. So I don't know if I answered all your questions, David. Probably
better than I was even thinking. Thank you. And the growth, 38 communities. And that's rural, I assume, some frontier as well as urban.
Yeah, we're about 50% rural and frontier, and then 50% urban. And it really disproportionately, I would say, matches the population of Oregon. 20% of the Oregon's population lives in one county in Oregon, in Multnomah County, which is where Portland exists. So when you think about where people live, we are disproportionately serving rural and frontier communities where there are the least amount of resources, where there are social isolation, where families depend on their neighbors. They depend on their community to be really that parenting support. But again, we've got nurseries in urban centers like Portland and Salem and Eugene, and then all the way out to the coast. We're building one in Coos Bay, Oregon, and then we've got them in Ontario, just on the other side of Idaho, and up in Pendleton, in the northeast corner of the state, and everywhere in between.
It's phenomenal.
So many thoughts came up as you were just talking just now. One of them is that you spoke about supporting the legislators in order to do what they have to do to fund the public piece of the relief nurseries. Can you dive into that a little bit more? What do those policies look like? And what is that revenue stream that communities would need to look for from their public partners?
Yeah, and I can't speak to how other states run their governments. I know in Washington, they've got a similar approach to Oregon, where, when you're looking at the upstream investments in families and in children, and really let's make it even in businesses. Let's look at upstream investments in businesses. What is it? what does it take to invest in your state so that in 20 years, in 18 years, when this child that's born in 2023 is old enough to hold a job, how do we have that child ready? How do we help? What are the investments we've made in 18 years to ensure that they are either ready for the workforce, that they are ready for higher education? And what we know now is what research tells us, that the more that we invest in the first 1,000 days, the first 2,000 days of life, the better outcomes we will have at age 18, at age 20, 30, on and on, that there is clear evidence. And we have a study that just came out by Echo Northwest. For every dollar invested in relief nursery, you'll see a $3 return. So legislators, have a tough job. They're looking at, what do you do with a state budget? Where do we put dollars? It's often easy to put dollars where just to triage what is happening. And let's be honest, in the last 3 years, we've been triaging, where are we bleeding, as a society. So getting legislators to think about investing dollars in prevention. We've seen some national policies. The Family First Prevention Services Act, led by our own Senator Wyden, is an example of a federal policy with the intent to put dollars in prevention. Oregon legislature has been investing in relief nurseries as a prevention program since probably the early mid 1980s into the early 1990s. And then what I talk with legislators about nearly every week is expanding that investment. So when you think about policies, there are a number of policies that kind of codify these kind of investments. We're not there yet. This is my work over the next 10 years of increasing our policies and knowing where we're getting the return on investment and making sure we have policies. I'm working with, groups at OHSU and, really looking at what do we need? But in Oregon, pertaining to relief nurseries, what we have so far is what we call our Oregon administrative rules and Oregon statutes that codify what a relief nursery is, how you certify a relief nursery, what it has to do. So OARN, my organization, certifies relief nurseries, and then there's a process for developing them. On the horizon where I see we need to go is a policy saying that when a community builds a relief nursery, that the state will support that relief nursery. Right now, that state support is a little bit uncertain and insecure, and we're seeing the impacts of that. But I think public policy and having legislators arm in arm with the private sector is hugely important. This is a bipartisan issue. Children being safe, children staying with their families. This is all of our work. It doesn't fall on, it's not a red or blue issue. It is a family issue. It is an issue that we've got to work on together to make sure that families have what they need, because it will benefit all of us depending on, what your intended goals are. If you're wanting a strong workforce later on, or if you're wanting to reduce financial public spending on foster care, child abuse, youth corrections. If you want to decrease investments down the road, increase investments early. And relief nurseries are one. We work with the ecosystem of different home visiting partners. We work with Healthy Families, Oregon, Nurse Family Partnership. We have a program called Babies First and maternity case management here in Oregon. All of these, we see ourselves as partners, as a network, and that our nurture, family support and connections, all of those home visiting programs, we work together to make sure that every community, our goal is to make sure that every family and every community has what they need. I don't know.
Amber, are you able? Yeah, it's beautiful. Amber, are you able to talk about any level of what outcomes we're seeing as a result of this? I mean, people care about it. I mean, you have to blend stories, advocacy, and measured outcomes to get cost benefit, and then societal benefit. What do we know?
Oh, absolutely. We're seeing just such a change in the investment of the cost of a relief nursery versus the cost of juvenile incarceration versus all of those things. And on average across the state, 90% of the families that use and experience relief nurseries do not go on to experience child abuse or neglect within the family system. 90%. David, you talked about family building blocks in Salem, and they have a 99% rate of graduates from their programs being able to go on and avoid some of those concerns that they had, stressors that indicated they could go that way, that instead they're going out and they're having these safe and thriving. We talked about legislators, and I'll pull it together. I was meeting with one of the legislators and her aide. When we brought up the name, she's like, oh, my siblings were in relief nurseries and it made such a difference. And she was so enthusiastic, and we got, an ally for life in that legislator from knowing those personal experience. And this is now somebody who's going on to work in policy and in our lawmaking. And it's just a beautiful example of this transition. So our outcomes are, it just feels like that's the story right there, that 90 to 99% reduction. Those children don't go on to be incarcerated in our juvenile justice system. They're doing better in school. They're just much more supported. And we also see it within our own workforce. A great outcome where there was a new hire, a young lady who had been part of a relief nursery when she was young. And she was hired at the same relief nursery that served her family. And her home visitor was the lead teacher in mentoring her into this new job. So when we talk about that future investment, families come back and they want to engage and help do this great work for others at the same time.
Amber, that's beautiful. Dana, I'll turn to you in a second. I'm just reacting to Nurture Connection's goal of helping families have strong, safe, and nurturing relationships, and building the networks of communities that support that to be true is, in essence, what relief nurseries are demonstrating to be effective. And then you see the generational benefit. Mm-hmm. It's like striking. It's really striking. Dana?
So Amber, we learned that the relief nurseries are in about 38 different geographies across Oregon, and those geographies expand: urban, rural, and frontier. Can you please differentiate what's the difference between the frontier and rural, and also what a day in the life of a relief nursery worker looks like?
I'm not going to give you exact statistics, but rural frontier communities talk about a certain density of population. So it's usually, I think, less than one person per square mile or something, a very low number. So services out there require a lot of driving. Going into town is not going to see a Walmart or a pharmacy or those kinds of things, that they're really small, isolated communities that may or may not even be on primary travel routes. So communities you have to intentionally go to, and they're often so close and so tight-knit and so invested in their children. It's just beautiful. So a day in the life of a nursery worker, I would love to tell you that there's a standard day, but there never is a standard day. So our teachers start by getting on the bus. That we always have a bus driver and at least one sitter, as we call them, somebody to sit with the children, come along, and we go and we pick up children throughout the community. We have quick check-ins. Remember our home visit along the way, and I love your puppy. And bringing the children in, taking them into the classroom, and going through that classroom day. We have family style meals with the children who are serving themselves, who are learning to clean up their messes, who scrape their own plates, that really do. Is quite a beautiful thing. They're having process art. We're not looking for that beautiful picture to send home to the parents. We're looking for our children to have that great opportunity to explore what paint feels like and what happens when you splatter it. And we do that for some sensory play. We have outdoor time. Our outdoor time is seen as a continuation of our curriculum. We're continuing to connect with them while they play and explore outside. We use a lot of pictures to help children identify their emotions. We have a lot of opportunities posted for how might we navigate this emotion in this moment. And we can have a very distraught little one and help them walk over to the poster of the different breathing activities or different ways they might navigate this big, strong feeling. And they choose one and they use it. And it works because we're giving them that strength and that confidence and that connection. They get lunch again before they leave. And then we're going out on home visits. Again, there's a bus drive that takes them home. In our mature nurseries, when you begin, you don't have to have a bus. That's a big step. But it's a progression of what we provide. And then we have home visiting. Those home visits are meant to engage with families and help them remember the joys of parenting, help them remember just how simple a good parent-child interaction can be, to help them deal with whatever challenges they're facing, help them identify not only what they want their outcome to look like, but help them create their own steps towards that process and then supporting them with that. It can be also talking about their recovery, their mental health, engaging them in those specific services. And we often bring food boxes or books or diapers to the visit, depending on the family's need. They're just a beautiful story of a mom that had really struggled to engage in services, and the home visits began being very focused on the little one. And the home visitor brought out cookie baking materials, and they're baking cookies. And we'd been working with this family for months, and we had a breakthrough. And mom's positive childhood memories were around baking cookies with grandma. And the floodgates opened of that mom's story and what was preventing her from being the parent that she wanted to be. And it was something as simple as baking cookies in the home. And there we are. And we have that wonderful, beautiful flexibility to do the things that we think will engage our families the most. And we have parenting education. Our parenting education always includes childcare. It's offered in the same nursery. We're taking care of families in the way that they want. And they can also, then their home visitor is familiar with that curriculum and repeating that both in the classroom and in the home. So a day in the life, there's also the crisis calls that come in, the person that needs you to drive them in for their mental health appointment that they finally felt ready to go to, that we're there to make sure that transportation isn't that barrier. Just such a wide variety of a little bit of everything, and never able to anticipate the exact thing in your day, but a good rhythm of helping and engaging with relationships with the families.
Dana, could I just add on to that? Amber, I just loved hearing you talk about and was flooded with memories of driving the bus myself and going on some of these home visits. It strikes me too, the programs, states that are looking for programs that families need, it's programs that are flexible, that there aren't these rigid, while we have quality assurance standards, part of our standard is responsiveness to family need. So, if your state catches on fire, you might remember the Oregon fires that were happening, or, in California right now, Dana, the flooding that is happening. do you have the services, family-centered services that are flexible, that, when in Oregon, one example is when we had our forests burning down and families' houses were burning, the relief nursery in Eugene, the relief nursery in the Salem Canyon area, they set up respite care for those families. So families are, have their kids and all their belongings at the fairgrounds while they're coming to the relief nursery for respite care, while the parents are going back and kind of trying to go through the ashes of their home. So that's just one example of being able to, on a dime, really engage the community. Volunteers come in. We're handing out food boxes in the pandemic, providing classroom services virtually. We had about $100,000 donated to buy computers for families so that they could receive services virtually. I mean, I think the story is so complex, but the engaging community is a key part to it. This is, there are models where a government, as a legislature, could buy a model that is fully funded, and is, maybe a national model. Well, there are some pretty strict restrictions that they have. So this kind of model requires community engagement, we have about 125,000 volunteer hours every year in Oregon at relief nurseries. That's a tremendous amount of volunteer time given to families. So I just wanted to add on, in addition to what paid staff are doing, the volunteer workforce that are operating nonprofits, the boards of directors, the classroom volunteers. It really does take a village. And we say that at OARN, that together with Oregon communities, we're the village it takes. And I really stand by that because I've seen it happen. I've watched it happen, and I can read the data of why it makes a difference.
Wow. I find myself thinking, how does a community decide to engage? And what's the process you go through or they go through in terms of beginning the journey?
Yeah.
Because I think that's important for so many other states, perhaps, and plus also the other communities not yet served in Oregon. How does that happen? I'm really curious about that process. And I bet it's relational and also narrative storytelling from one community to another.
Right. Thank you, David, for that question. And I think what we need to also ask is, who are we not serving and why? Are there communities who, for whatever reason, and let's think about what are those reasons why those communities might not be raising their hand? And I think that has to do with rural and frontier communities, poorer communities, and I mean resource poor financially, who are just trying to keep their heads above water. So I want to say that as a caveat. And communities that have been disproportionately impacted by racism, I just can't go without saying first that we're not doing enough. And we have a process that has been working for 38 communities, getting ready to add 3 more. But let's not think that our work is done and we have it figured out, because that's what we need to figure out, how to reach every community. But communities come to me and I say to me, there's a link on my website that says the OregonReliefNurseries.org. So you want to build a relief nursery, they fill out a form. Usually they know a local judge, like one judge calls another judge and says, hey, how'd you get a relief nursery? And that judge knows someone, knows Judge Ann Aiken, knows some of our advocates in the state of Oregon who say, oh yeah, here's who you need to talk to. And then we just start working together. We rally community leaders. We listen to parents. And we have a whole process around we have 16 early learning hubs in Oregon. And so we look at what we call their sector plans. Every early learning hub in Oregon has a sector plan. And so it's a long process. We talk with the hubs. Is a relief nursery exactly what your community needs? And then, of course, you have to have the private sector. You have to have business leaders writing letters of support and serving on boards. You have to have a 501c3 and commitment, really demonstrated financial commitment from the community, and demonstrated kind of sweat equity of that people are showing up to board meetings in their free time. I met with a lot of boards virtually out in Baker City. I met with boards down in Coos Bay and in Toledo, really helping them put legs on their own relief nursery. So it is not for the faint of heart. And I would say it's doable. And we have more work to do to give equitable access to relief nurseries in Oregon. So I have a lot of great thinking partners working with me to figure out how do we expand equitable access to relief nurseries.
And I'll build on that. Thank you, Cara. It's the path to which you get to Cara, the path to which you build your nursery varies so much. We have nurseries that ended up growing into large nonprofits with many other programs. We had large nonprofits come and bring in a relief nursery. Many of our relief nurseries stand alone in the community. One of our newer relief nurseries, a woman in the community said, "This is what I needed when I was young, and I would have had such a different life if I had had a relief nursery." And that was what motivated her to engage with the local tribe, to engage with the local political landscape and with the businesses to say, you know, there's a lot of people who really need this. And it was her compelling story and passion that brought the relief nursing into their community. So it can be one person who builds that coalition. It can be a coalition that decides to go looking for us. And there's just so many paths. And again, it's this beautiful flexibility that the model has.
Amber, it makes me think about cultural specificity and cultural congruence.
Mm-hmm.
You know, in Oregon, our tribal communities, our Somali communities, certainly our small African American community, Hispanic communities. Mm-hmm. Does your model touch cultural congruity also? And how do you approach those questions?
We are very responsive to individual families. So we're coming in and we're listening to your stories. We're asking, what would your family do about this? We're asking, and we're really building upon that family's internal culture and exploring with them if they want to be congruent with this particular aspect of their culture, or if they want to find new ways, and supporting them either way. And our workforce, we have a large bilingual workforce. In many cases, our workforce is very reflective of the community that they're serving. We have relationships with some tribes. We are looking to start connecting and building more relationships, but we're not here to rescue anybody. We're here to engage with communities in the work that they want to do and to support within their communities. So we also provide technical assistance for our local nurseries. There is a community that serves Mayan folks. And often when folks hear this person is from Guatemala, they assume Spanish. And so now we're working with the refugee organization as well to make sure that we're using the correct language and that we're not making assumptions about those cultural based on your geography, but more on your family and your people group.
Nice. Dana, we're starting to come around to about 7 or 8 minutes left.
I'm wondering, with the last couple of minutes, and starting with you, Cara, if you can talk about what is your vision for the future for the relief nurseries?
Yeah, thank you, Dana. Boy, I love thinking about the future, so I will try to limit my comments. The Oregon Association of Relief Nurseries has a vision on our website, and that we hold that all children in Oregon grow in safe, nurturing, and stable families. So what does that look like? We have 38 sites across Oregon. We're in about 20 counties. Oregon has 36 counties. So, we need to start with, how do we get a relief nursery to every county in Oregon? And then parallel to that, not in place of that, how do we stabilize the current footprint that we have to ensure that relief nurseries have those financial resources that it takes? So I have this vision that there is a circle of philanthropic champions that no matter what the winds of change that happen in Salem, that's where our state government lies, no matter what those winds of change are, that there would be a philanthropic community that would say, not on my watch. That relief nurseries will continue to grow and thrive, and that there will be financial resources. I think when I look at where dollars lie, for sure our government has a lot of dollars, but our philanthropic community is rich in resources, and they have the opportunity to change Oregon's future. So, my hope of what's coming is that I'm supporting Amber's vision that she'll probably talk about, that the relief nursery continues to improve and become the gold standard of this early relational health and this infant and early childhood mental health model, both for Oregon and for the state, but really that we would have the resources to maintain and grow the network, so that every community who raises their hand, regardless of the resources that they have, every community I can say yes to. We're not there yet. Right now, we have a ways to go, but I believe that the heart of families is out there and that people care. So I'm just looking forward to cultivating that circle of champions.
Amber?
So many dreams on top of Cara's. So I have the opportunity to work with our workforce to build up their skills and their capacities and their passions. And I want us to be highly trained. So my goal is to be an infant mental health center of excellence in Oregon, that we are able to take what we know about early relational health and infant mental health and become that model that other programs are coming to and looking for us. In Oregon, for young children that are struggling in classrooms, we have mental health consultants that come in and teach the teachers. Relief nurseries don't really use them because we're training our teachers to see that behavior as communication and to listen to that story that's coming with that communication, and to help write something that's more supportive of the children. So it's wonderful that we're supporting teachers across the board. And my dream would be that we rise that tide and lift all ships, right? So continuing to build out that sense of wonder within our workforce, of that expertise, of knowing how to be more and more trauma healing, not just informed, but to create those paths to making trauma be a part of your life, but not the story of your life. And just bringing more and more opportunities across the spectrum to our workforce, that working for a relief nursery becomes a huge badge of honor, that it already is, but to spread that word.
Phenomenal. Dana, final words, and then I'll add a few, and then we can finish up.
Thank you for sharing the story of the relief nurseries, some of the advocacy work, what happens on the ground, and the vision for the future. I certainly feel so inspired. I wish that we had more relief nurseries, and so thank you for your time and wisdom.
Yeah, I'm in similar line. I'm in love with the relief nurseries as I was a couple of decades ago, ever more now, where you've really taken all we know to the next level of true partnership, authentic learning, but also the valuing of every family's opportunity, every family's goal and desire, and meeting them where they're at, mobilizing a community that cares too about their children, their families, and helping that become a reality, and then showing generational impacts. I mean, it doesn't get more beautiful than that. And, we will, as our Nurture Connection movement grows, your work will be likewise visible. And so let's stay in touch, stay tuned. But again, thank you for your time, for your wisdom, for your heart, your commitment, your soul in this good work, and your inspiration for a vision that I think we all carry. So be well. Thanks so much. And to the audience, join us again next month. It'll be on April 19th. You will hear soon as to who our next conversation will be with. Thanks again.
Thank you so much.
Thank you.